The diagnosis of tubal infertility is extremely important. The diagnosis of tubal infertility may be more important than treatment. If we cannot diagnose correctly whether there is tubal obstruction, where the obstruction occurs, and the extent of the tubal blockage, then our treatment may go astray or result in misdiagnosis and mistreatment. Mild adhesions and blockages can be exacerbated into severe adhesions and obstructions. And even a relatively treatable infertility can be turned into absolute infertility. The best diagnostic method for tubal infertility is dynamic digital hysterosalpingography with iodine contrast. Many hospitals avoid using contrast agents or only perform simple imaging. The problem with simple imaging is that sometimes it can capture pathological images and sometimes it cannot, which can lead to misdiagnosis and mistreatment. Beijing Antai Hospital has acquired a small robot that adjusts its own pressure based on the patient's condition to automatically inject iodine contrast into the uterine cavity, fallopian tubes, and pelvic cavity. The advantage is that the doctor does not need to manually manipulate the catheter. Therefore, we welcome patients to undergo dynamic digital imaging. The second characteristic is that it not only allows us to dynamically see which parts of the fallopian tubes are blocked or unobstructed, but also assess the degree of blockage and functional loss. This provides important methods and measures for our subsequent surgeries and guides the choice of doctors. For example, in cases of severe tubal diseases, we choose experts in the field of tubal diseases who have many years of experience in surgery. Tubal surgery is delicate and fragile, and if not performed well, it can cause secondary disasters and more serious injuries. Therefore, in terms of equipment selection, technical selection, and surgeon selection, it has important guiding significance. Dynamic digital hysterosalpingography not only avoids the use of catheters, but also makes our imaging more accurate and precise. Some patients are diagnosed with no tubal issues at other hospitals, but when we examine them, we find tubal diverticulum or tubal leakage, which cannot be seen with static imaging. Therefore, if you suspect tubal infertility, you must undergo dynamic digital imaging.